I will be discussing the ultrasound guided nerve blocks, iliohypogastric and ilioinguinal nerve. I will be briefly discussing anatomy, techniques, procedure, complications, and the most important segment of my lecture will be indications. So let's have a brief recall of the anatomy. Ilioinguinal and iliohypogastric nerves are part of the lumbar plexus. They arise from the anterior primary ramus of L1 and also receive a branch from the 12th nerve. Now, as you can see here, look at my cursor. Now, you can appreciate here that these nerves have their origin from L1, but there is a small contributory nerve or branch is coming from the T12 and it's joining the L1. So the nerve root value of ilioinguinal nerve is L1, while iliohypogastric nerve has a nerve root of T12 and L1. So they have the same path. They share the same path after coming or emerging from the lateral border of the psoas major muscle, but on reaching the iliac crest, their paths divide. At the level of iliac crest, ilioinguinal nerve enters the inguinal canal and it supplies the skin of the external genitalia. To be clear, not the whole external genitalia, but a part of the skin of the external genitalia. While iliohypogastric nerve, it divides into lateral cutaneous branch and anterior cutaneous branch. As you can see here, this is lateral, and it supplies the posterolateral gluteal region, while anterior cutaneous branch, this one, it supplies the hypogastric pubic region. And both of these nerves have their motor supply for the internal oblique muscle and transverse abdominis muscle. Now let's have a look on the ultrasound guided nerve block technique. So your patient should be in supine. Ultrasound probe, you can use high frequency linear probe or curvilinear probe can also be used if your patient is obese. And the probe placement is along the line joining the anterior superior iliac spine and the umbilicus. As you can see here, an imaginary line joining the anterior superior iliac spine and the umbilicus. You will put your probe in oblique direction. This is another elaboration of probe point. This slide is for the postgraduate students and the new people in this field. If you look closely on this picture and pay some attention, you will find some similarities between these two pictures. This is a classical pirate ship or pirate boat appearance. So some easy procedure tips. Now, nerve identification, usually nerves are visualized between the muscle layers. If not, then what you can do hydrodissection and you can also go for hydrolocation. I will tell you later what is hydrodissection and what is hydrolocation. Needle insertion can be in plane or out of plane, depends upon your level of expertise as well as the physique of the patient. If patient is obese, then you can also approach the patient from out of plane. Now, drugs you use are the local anesthetics, bupivacaine, ropivacaine, xylocaine, local anesthetic, and as in combination with dexmedetomidine, dexamethasone, or tramadol. Now, 10 to 15 ml is enough in adults and 0.15 ml per kg for children. You have to take precautions while performing the block. If you go too deep, like over here, so you can it can result in fascia iliaca block. Now, if you look here, there it is iliacus muscle here that is covered by fascia iliaca. So if your needle comes too deep and it pierces the iliacus muscle and you deposit your drug here, so it may of course lead to fascia iliaca block. Now, this is hydrodissection and hydrolocation. Let me tell you about hydrodissection. Now, as the name indicates, hydrodissection is basically you use water to dissect away the tissues or the facial planes. Now, in this picture, you can see this is a facial plane that is being splitted or dissected away with the normal saline or water. And over here, hydrolocation is basically when you are unsure about your needle tip, you can give few mLs, 0.5 to 1 ml of saline or the distilled water to just confirm your needle tip. Okay, so you can have some complications. I hope you won't have some complications like block failure, bowel puncture, retroperitoneal hematoma, bowel hematoma, transient femoral nerve palsy with transient cordyceps paresis. Indications. Now, before going to the indications, I want you to have a look on this slide. As you can see, these two nerves have no innervation for the viscera or the osseous or the bones. They have a very little part they supply over here, over here. So keeping this very little part in mind, now let's see what are the indications of this nerve block. You can use it for acute pain. You can also use it for the chronic pain. You can use it for post-op surgical analgesia, and you can also use this for surgical anesthesia. That means some surgeries can be performed under this block. I will tell you later how. So inguinal hernia repair, orchidopexy, hydrocele repair, varicocele surgery can the pain can be relieved, or they can be used for the post-op analgesia, or these procedures, and also in combination with T11, 12 intercostal nerve blocks for pain relief after the renal transplant. And these surgeries can be performed under the iliohypogastric ilioinguinal nerve block, and I will tell you how. And for the chronic pain, this nerve block is also can be used as diagnostic purposes to identify the source of pain, for example, like neuromas. And now coming to the point that how the surgeries can be performed under this block. If the inguinal surgery is planned, then you should know that for inguinal surgery, not only you need to block the ilioinguinal iliohypogastric nerve, but also the genitofemoral nerve. So for that, first you will perform your block and ask the surgeon to just carry on with the surgery. And as soon as the surgeon reaches the spermatic cord, just request them to inject 1 to 2 mL of local anesthetic into the spermatic cord area. And then there you go, genitofemoral nerve will be blocked and surgery can be performed. Thank you so much.